Following my video today, which I posted in X and Instagram, and will be also in our YouTube, I like to share with you a number of the scientific evidence and historic data that might help you to decipher most of this issue with regard to the acetaminophen or vaccine that I call it the TikTok rebellion. Uh, as I mentioned it, Tylenol was approved by FDA in 1959. I do not have any interest or any financial attachment to any pharmaceutical. However, I'm more in the scientific issue. The study that I mentioned this morning is vital. The vital study stands for the Tylenol or acetaminophen vitamins and lifestyle. There are two vitals. I want you to remember this. This was done in 2000 and 2002 in Western Washington State. And the results of that, it was an association. There was some association with the hematological malignancies, but it was not a solid, and there was no any other association with other cancers. There was even suggestion with regard to the positive effect on prostate cancer. But the effect on the hematological issue was on those people who were heavy users, and also it was a questionnaire. It was an epidemiological studies, and people reported, and their results was based on the self-report. So, in this kind of a study, there is always issue with validity. However, it's there, and in order to get to the bottom of all of those, we need further studies, more scientific data driven for any issue, including this material. Also, another historic issue that I want to share with you in 1796, a physician by the name Edward Jenner noticed that at that era, the cowpox or smallpox was widespread, and Dr. Jenner noticed that some of the people that works in milk industry at that point, they call them milkmaids. They did not contract the cowpox. So he was curious that maybe they were exposed to this bacteria. As a result of that, he get a wound involved in uh, cowpox, get a extract of it, and inoculated in a 8 years boy by the name James Phipps, and that create immunity. That's a historic data. We have historic data with Pasteur. We have many others since 100 years ago. The vaccine has been instrumental in saving lives globally uh, with regard to the smallpox, poliomyelitis, tuberculosis, measles, and many other diseases. And vaccine has saved millions. Well, the scientific data include studies, observational, and different type of the placebo-controlled, multi-center, large numbers. However, the historic data is also very important. Uh, as a result of looking into the historic data, there are more than 100 years evidence for improving life, improving the lifestyle of the children and adults uh, who suffered from tuberculosis, the polymyelitis. You guys might not remember, but the treatment was devastating. It was an iron lung that the person should live in this long. That was a capsule. But anyway, in the world, across the globe, we have millions of people that has benefited from vaccine. So, in order to refute any vaccine, whether it's autism, whether it is other diseases, we have to really do a large study. And until that, we have to suffice to the current studies that has been provided and also the historic data that is all there. I also look at few numbers and few studies. Just you can Google it as I did or check few things in the library. The American College of Obstetrician and Gynecologists reported Tylenol is safe for pregnancy when needed. Untreated pain or fever pose greater risk like miscarriage or birth defect. Autism Science Foundation reported deeply concerned about stalking fear without proof. Decades of data shows no cause causal tie. American Academy of Pediatrics observational study can't prove cause. Discouraging Tylenol without alternatives endangers moms and babies. World Health Organization and CDC acetaminophen remains first line for pregnant women. Evidence is mixed and inconclusive. Uh, Kenyu Tylenol marker. Independent science clearly shows it does not cause autism. The announcement risk confusion and alarm. In a 2025 meta-analysis in Nature, echoed this. While some population studies show a modest association, for example, 20 to 30% higher odds with the frequent use, confounding factors like genetics, maternal illnesses, or recall biases explain it away. No randomized trial exists to confirm causation, and autism rise in better linked to improved diagnostic and awareness. My point for reporting all of these and my previous uh, video is yes, we must be concerned about general health. We must be aware of the risk and danger of any medication that has been in the market for hundreds of years or 50 to 100 years, digoxin, aspirin, coumadin, many of these medications, we have to be vigilant. We have to uh, take care of our patients, but we want to be scientifically proven. Our data should be science driven. We should have a randomized trial, larger scale, in order to refute any type of medication or instrumentation or procedures. Because as we see, many medication has changed the course of the history. Digoxin did. Digoxin is by itself a poison, but it changed the course of the heart disease. Beta blocker, ACE inhibitors. We have eliminated most of the side effect of the or complication of the high blood pressure. So here is a word of advice to Mr. Secretary. Please take the scientists, create a assembly of the scientists, and let's do studies. There are thousands, 100,000 of physicians in across the United States that has proven safety of many medication. You can ask them, and then also let's do randomized study. I'm sure all the physicians, all the scientists, all the researchers, all the teachers in medical field, they are happy to support and help in this matter. Word of advice, although I'm not the person who give advice to President of United States. However, just Mr. President, check with many physicians, check with scientists. Do not listen to one person, and also look at the historic data. We will follow this in different aspects in